friends, very short and very important discussion on present day problem of sudden cardiac deaths. Lot of youngsters are dying in the gym or dying during the exercise, walking on the road, cycling, in the office, performing, stage singers. And most recently, we have lost our lady who was giving countdown to Chandrayaan 3. And we are losing people every day. Another 2-3 days back, we lost a Ghaziabad young boy on the treadmill. Before that, we lost a couple in the village setup who were just on their first wedding night, who were non-smokers, non-diabetic, young couple, village setup. So what's happening? There is something which is happening especially, and I would say part of it is responsible for post-COVID status. So combined everything, let me define you sudden cardiac death. Sudden cardiac death is because of either arrhythmia or due to the congenital abnormalities of the heart, due to a strong heart, due to hypertrophic cardiomyopathy, or due to ECG abnormalities like short QT, long QT, or very specifically named syndrome like Bermuda syndrome. This death does not give us time to take the patient to the cath lab. It gives hardly 10 minutes to manage, and the death is within 1 hour or 2 hours of the event. Like a football player who was healthy, he died in the field. This is commotio cordis. This is commotio cordis. Blow on the chest. So sometimes blow on the chest in a specific phase of diastole can cause commotio cordis. And we lost one very important US player like that. So we lost certain singers. We lost, starting from old days of my days, General Joshi, who was a golf player, chief of army staff, monitored every day twice. We lost Abdul Kalam Saab, our revered Bharat Ratna president. So if we go in the past, these were not common. Why I am giving examples of the past? Now it has become very common. We know the background. Coronary artery disease in India is 10 years before it sets up in the countries like Europe and USA. First reason. Second is we are adapting to lot of Western lifestyle patterns, and we are losing our old ancient dincharya. So all this combined, it makes us prone to have risk factors like hypertension, stress, lack of sleep. Apart from that, we are increasing diabetes. Increase in diabetes by 7% post-COVID has been researched in our own Indian setup, Delhi setup by Dr. Mishra. And he has reported 7% increase in diabetes and roughly same increase in obesity. So obesity, stress, smoking, alcohol, lack of sleep, all these causes combined are adding up to the already existing conditions which give rise to sudden cardiac death. While a heart attack gives us time, it does not happen suddenly. So what we require is Dr. Agarwal's teaching. Dr. KK used to teach everybody CPR. In the schools, in the police setups, in the social setups, we should teach people CPR. 1. 2, we should have defibrillators installed at important places like market, like airports. I'm very proud to say in Ganga Ram Hospital, each floor in the OPD, each floor in the ward has got a wall-fixed, wall-mounted defibrillator. So this should be installed. Now, how to avoid? This is a preventable death. We should start monitoring our cholesterol. Again, we have done research at the Ganga Ram Hospital at the age of 18. Be careful for your lipid profile, blood pressure, weight, what you call obesity, monitor your waist-hip ratio, monitor your BMI, and all this combined. If you have any problem in the blood pressure or otherwise, then go to the doctor, consult the doctor. All the gym goers need to be medically examined if they are doing very, very strong running treadmill exercises. For routine exercises, even in the gym, you don't need a regular medical checkup, but once in a while, yes, once in 6 months. But those who are making heavy treadmill runs or those who are doing very strenuous weights, exercise with running, slope treadmill running, more running, more than 20 minutes. They should be cardiac cleared boys, girls. Be careful because we have lost so many youngsters during the recent past. So I would say cardiac deaths can be prevented if we monitor our blood pressure, our blood sugar, our weight, our sleep pattern, stop smoking, stop alcohol, and have yoga, whatever form of vyayam exercise you want to do, and disciplined life. So thank you all for listening to me. Thank you.